Alright, June 30th, 2026. A new review posted by a customer and patient of Grandview Medical Group Neurology. Their office is located at 3690 Grandview Parkway, Birmingham, Alabama. This is just off Highway 280. We have some previous videos on how this neurology department had some kind of major disintegration event culminating in 2025. Close to 4 or 5 doctors were either let go from this place or walked off the job in the space of a few months. Summer 2026, and it looks like problems continue to persist within the neurology unit of one of Alabama's largest hospitals. This patient writes, in the 3rd week of June, I am 80 years old and was admitted to Grandview ER and hospital after having a stroke on May 11th. After discharge, I was provided with written instructions to follow up with Grandview Neurology within 2 weeks. After multiple phone calls and referrals from my GP and cardiologist to the neurologist, I eventually had an appointment for July 6th. I was called today by an extremely dismissive person from Grandview who canceled the appointment on the basis it was for a second opinion. Not really sure what happened in this case. Multiple reports out there of the neurology department being severely understaffed. Along these lines, patients who have been with Grandview for decades are mentioning how medical services and exams for conditions that they had done traditionally all of a sudden were a no-go area. I found this job solicitation dated 22nd of June 2026 on the Fish for Jobs website, and it's for a neurological physician in the Grandview Medical Group. So it looks like they're actively still trying to staff this place, keeping a close eye on the situation in this Beleaguered hospital. Yes, ma'am. I'm trying to reach the office of CEO Daniel McKinney.
One moment. Thank you for calling Grandview Administration.
I was a patient for Grandview Neurology, Dr. Hudgens MD. I called their office yesterday, September 26, 2023, to discuss billing and service issues that arose during my visit. I had a broken skull injury I was dying from. I showed the doctor, printed out X-ray, CT, MRI showing the injury clearly. Dr. Hudgens, looking at the same images, told me no injury appeared there. He provided no useful service in my visit, $265 cash. I would like to inform the CEO that Grandview Neurology staff now use pseudonyms, nicknames, and false names when dealing with the public. I was hung up on when requesting a first and last name from the staff I talked to. She identified herself as Ronnie. At the same time, the representative for the MD make $140 an hour after going to school for 10 years. They request access to patients' PHI personal health data. They seek to remain anonymous. In my case, this practice is now being abused because it's being used to conceal negligence and liability. Also, a HIPAA issue is involved, withholding medical records. When I talk to someone about $1 million health issue, I'm going to have a first and last name for my records keeping before I talk to that person. That's professional. Your customers and patients who pay you money will not accept this corrupt practice, and it will one day soon be done away with, mandated by law. So you heard it here first. Still trying to talk to someone at Grandview about my bill, and you can reach me at that phone number. Look forward to talking to you, sir.
Thank you for calling Grandview Medical Group Neurology. The office of Drs. Kyle Hudgens, Rodney Swilly, James Strong, Drew Ureg, Stephen Suggs, and Natalia B.
Hello, I'm trying to reach Ronnie.
This is her.
Yes, ma'am. I called yesterday regarding my bill and a visit with Hudgens.
One second. What's your date of birth?
Okay, do you have a last name?
I'm not giving you my last name, sir.
Okay, so
I'll give you my initial.
Okay, Grandview doesn't give the first and last names of people that deal with the public?
I can give you my first name and my last initial, sir,
Well-
but I did
well,
not
no-
give out my last name.
No, ma'am, you'll give me your first and last name, or I can't talk to you.
Okay, well, unfortunately, I will not be able to talk to you then. Thank you, and you have a good day.